And welcome back to Consumer Choice Radio, broadcasting here on Sauga 960 AM and the Big Talker Network. David and I promised you an interview, and there's a lot of different topics that we've tried to cover over the last few weeks, David. We've gone back and forth, all kinds of things up and down North America, but at least one topic that remains of interest to all of us, and I think likely many of us who are dealing with our parents or friends or family. Yes, we're talking about healthcare. And we wanted to talk specifically about competition in healthcare, other models of healthcare, and perhaps how these models could help inform our own policymakers throughout Canada, throughout North America, about how it could be done better. So who better to bring in than an economist from the Montreal Economic Institute? We're speaking to Emmanuelle B. Faubert. She's here to give some perspective. So Emmanuelle, thank you so much for coming on Consumer Choice Radio.
Thank you for having me.
So I guess we'll set the groundwork. A lot of people were using a lot of the experiences of COVID and the pandemic as a sort of report card on the Canadian healthcare system. And this has, led to a lot of different debates and controversies. We've seen some things flare up in different provinces like Ontario and Quebec. If you could give us sort of your own report card right now on the Canadian healthcare experience, as it were, and then maybe we can open the conversation about how we can improve upon that.
Yes, well, we did a poll about how Canadians felt about the current state of healthcare in Canada. And what we see is that 1 out of 2 Canadians is not satisfied with the state of healthcare right now. And the trend there's 2 major trends that we see. The first one is that it's going up through the years. So the satisfaction is growing as time passes. And also another trend we see is that as people get older, so as people need more healthcare, we see that the level of satisfaction goes down. So the more you need healthcare, the less you're satisfied with it because you see the problems with it.
Go ahead,
I mean,
David.
that obviously sparks questions about change. A lot of the conversation in Canada, whenever we talk about the healthcare system, is binary, right? We don't want an American system, is what we often hear. But you've written and done some research in regards to some of the other models out there. What are they, and why may they be worth evaluating or replicating?
So one system we looked into was the mixed system in France and Sweden, where they have a universal healthcare system. So that's still public, that's still like what we have right now. But the difference is that healthcare providers can be either public or independent. So your health insurance card is going to work wherever you go, whether it's a private or public clinic, it's going to work. So in France, for example, 35% of hospitals are either nonprofit or independent. And that's something we could have here because there's some that reduces the administrative load and can lead to cost savings as well for the system overall.
Yeah, I've seen that.
At least just a quick follow-up.
Go ahead, David.
Oh, yeah, I was just going to say just a quick follow-up, because I think some of the naysayers on any type of mixed model would probably say, well, what if the private sector, the independent side is gouging the province whom they're billing? We end up spending more on healthcare. Do those systems which you just described spend more on a per capita basis than we currently do in Canada?
I don't have the numbers for that with me, but think about it, to open clinics and hospitals, usually, for example, in the public system, it costs a lot of money, it takes a lot of time. So imagine here, instead you have an entrepreneur who can build this hospital quicker, faster, and then treat the patients, as clients. This, by streamlining the system, this is how there's a lot of cost savings, by reducing the administrative cost and like the red tape that you see a lot in overall public systems.
Of course. And David, I know that we've spoken about direct primary care models that are right now much more popular throughout the United States, where people have essentially a subscription to a doctor. They only take out the sort of necessary catastrophic insurance and pay cash for their ordinary procedures. But as far as I understand, in different parts of Canada, that would be illegal. Particularly, that's the dirty word that comes out, the private. I think, Emmanuelle, you've done a very good job in sort of delineating, where there are other examples where you can have a mixed system. And that is how it is where I am currently in Austria, where a lot of stuff is done with cash. But if people want to use the e-card, our version of the carte soleil, then, hey, people are able to whip it out and use it wherever. But they also have the option to go to private clinics to get things done with private insurance. And they have that, and there exists a kind of entrepreneurship and competition within that healthcare market. I would love to see something like that in Canada.
Definitely, because when there's competition, there's going to be a battle of prices, right, between the providers. So there's usually going to be it's going to be better for the care recipients overall, because there's no monopoly of care.
Yeah, and one thing I read here from some of your studies is that apparently Quebec, the province of Quebec, spends about $1 billion a week on healthcare. And I know in the context of the latest provincial election, this was sort of brought up in every which way. And, it's the same to where David mentioned before, you essentially have the bad version, which is, private American healthcare. And everyone was very scared of saying that. There was only perhaps one person on the stage who we've spoken about before who did talk about a little bit of competition. But, what does it say about our political systems that they don't really entertain the ideas of a kind of mixed healthcare system? Why is it that we're afraid of entrepreneurship? We're not afraid of entrepreneurship when it comes to our phones or our brand new Tesla vehicle. But when it comes to healthcare, we somehow shy away at the idea.
Well, the American system is seen a bit as scary because we see stories of people getting sick and then having crazy medical bills, or just for giving birth, the bill can be in the tens of thousands. And people are scared that by including some private, it would be like as I say, the gateway drug, and then we would end up in a completely private system like in the US. So I think that's what people are scared of. And that's why they really don't want that, because they like being comfortable and knowing that if they're sick, they don't have to go in debt for it. So that's why we believe that we need to have a balance between it. We need to have a balance of the universal healthcare, but also have the balance of public and independent providers, so that people are better taken care of, rather than having all these super long waiting lists, and have the money follow the patient. That's what we believe in.
And another healthcare-esque related topic, which was huge, a huge conversation during the pandemic, and I still think it will be for a while, is long-term care. There have been a lot of different ideas floated around in Canada. I know the NDP had proposed a ban on private care in the long-term care space. You've written about Germany, what's described as a cash for care model. How does that work in Germany?
Okay, so in Germany, you have a insurance plan, the long-term care insurance plan that people pay throughout their lives. And whenever they get older and they do need long-term care, what happens is they have a choice. They can have institutional care, which would be similar to what we have here in CHSLD, in Quebec at least, or the other option would be to have a monthly payment that are given to the care recipients so that they can spend on that long-term care. And that payment in cash is a lot more flexible, so it can be for home care equipment, and to pay informal caregivers like family and friends, or whether it be to help prepare meals and stuff like that. So this idea here is that you give people choice and you give them more flexibility, so people keep more of their autonomy.
Yeah, definitely. I think many of the listeners are probably tired of me bringing up the comparisons, but I've seen this in Austria as well. There's a cash payment to, my in-laws' parents. They received a cash money, and with that, they're able to get a couple of Romanian home takers. They came into the house, took care of them, got all the equipment, and provided them that long-term care that they needed, until they unfortunately passed. But, that is just something that we don't really see that's built up in many of these models. And I think, unfortunately, it's going to have to take we'll have to go back to the Paul Martin days of it. We're going to take some kind of left-leaning, compassionate argument for the need to change this because now is the time. I don't know if it's going to take a crisis, Emmanuelle, to get there, or perhaps it's just going to be some other opportunity. But I don't really know if many of the politicians are listening to innovators or entrepreneurs. It seems in this case, they're just going to have to listen to voters at some point, which makes me kind of cynical.
Well, if we look at the poll we did earlier in the month, we can see that 71% of Canadians think that increasing healthcare spending has not made a difference into the state of our healthcare system. And even one out of three Canadians thinks that even made it worse. So it shows that people are ready for change. Also, 64% of the people questioned for the survey were in support of having a system like in France or Sweden, the mixed system I was talking about earlier. So this poll shows that people are ready for change. And people want change, and we're trying to help give them solutions of how to do it.
I mean, so if we've established that there's an appetite for this, there's probably going to be a lag politically. But one of the big kind of looming questions or counters would be, how do those mixed healthcare systems perform in comparison to Canada in regards to outcomes? Do you have any data or information in terms of how they compare? Because I could see some arguing, well, it may be nice to have a mixed model, but if the outcomes are worse, then we want to avoid that.
Mm-hmm. Well, in France and in Sweden, you don't have waiting lines like we have here. That's one of the main differences. They don't have waiting lists. They don't have to wait weeks, months to see doctors before even cost savings. And I think that's the biggest difference we can see is the impact on the patients themselves. This is why we had Shawili long ago, people waiting years to get knee and hip replacements. It's ridiculous. So that is the main thing we see. And also, for example, in the long-term care example of Germany, we saw that the growth of long-term care spending by the government in Germany was relatively stable, despite the growing need of long-term care. So it keeps continue growing because population is aging, but it's growing at a more stable rate. So we see there's no cost explosion that we would probably see because of the aging population. So that's the more financial trends we see, but the savings are more long-term usually.
Absolutely. Yeah, and I'm looking at the number
that's an important
current health expenditure as percentage of GDP. It's all around 10 or 11% for Canada, France, and Germany. So apparently Canada does have the tools. They can get on the same level. So last question to you, Emmanuelle. If there is a immediate change, something that we can push for, something that we can advocate for, whether it's just like one small piecemeal reform, what is it that you think you'd like to see in order to change healthcare and the model that we have in Canada?
I would like to see mixed practice being more common and accepted. Mixed practice, whether it's for nurses and doctors, that they are allowed to work in both private and public, and that Canadians are allowed to go see a private clinic when they need help and still get reimbursed for it. That's the main thing I would like to see short term, because these are more regulation changes. While long-term care and the private hospitals, these are more long-term changes. If these two first regulations can be changed short term, that would really help already.
I love that. All right, we've been speaking with economist at the Montreal Economic Institute, Emmanuelle B. Faubert. Emmanuelle, thank you so much.
Thank you. Have a nice day.